Joining us now for more on this is long COVID specialist. She's also the founder and CEO at Terrain Health, Dr. Robin Rose. Great to have you back. This was unbelievable today. Every Democrat on the panel clearly against what RFK Jr. is trying to do. Was he right? Is he right to fight Democrats and the medical community and Big Pharma? Is he right in what he's doing, in your opinion?
I do. I think he is right. I think, in the beginning, the vaccines, you can argue, were very helpful for the very ill, chronically ill, elderly patients and people that have weaker immune systems and things like that. But as the virus evolved, those vaccines were not as effective anymore, and we were seeing that there were a lot of issues with them, and people were having a lot of side effects, adverse reactions, and now have chronic conditions as a result of that. But nobody was willing to pump the brakes because I believe nobody was willing to take any blame. And, really, there should have been a lot more transparency around what was in the vaccines, what we were giving to our children, middle-aged adults and older adults. And we should have been having a debate about this, like a
Democrats still want to vaccinate children. Are other countries still insisting that we vaccinate young children?
No. So if you look at the EU, Australia, even in Australia, if you look at them, they were very hot and heavy on having everyone vaccinated. They don't even recommend the vaccine for 18 and younger anymore. The general recommendations for most of EU, pretty much every country except Germany, Greece, and Ireland, they do not recommend the vaccine for 5 years and younger. It is not on their schedule, and they don't recommend it.
Wow.
Countries like the UK, there's a Denmark and a few others. They don't even recommend it for 65 and younger unless you have underlying medical conditions. So there's been a big shift abroad. I don't know why, America or the USA isn't taking the same, having the same mindset or shifting in that direction as well.
Let me play you just a soundbite. This is Chuck Schumer of New York talking about, basically, we've heard this now for the last 5 years, and Democrats are still operating in fear, which is not the way to reach people. Take a look.
The damage RFK Jr. is causing right now will be felt for generations, and so many of our kids and grandkids will suffer. More of our kids will die from preventable diseases. The damage will be long-lasting.
Okay, I take it you disagree with that, but I want to sort of just tell people at home what your background is. You're a gastroenterologist. You worked in a traditional hospital for years of your life, and then this all happened, and now you've dedicated your life and career to helping people who are vaccine injured and are dealing with long COVID, which is really the same thing, get better. Can you tell us what you're seeing when people walk through your doors asking for help?
Yeah, so can I just say,
Please,
I'm a product of the conventional medical system. I'm vaccinated, my children are vaccinated, and what the true meaning of a vaccine is, it's preventable, and you're stopping transmission of that disease, right? You stop transmission of the disease. The COVID vaccines don't stop transmission, right? So the idea is if you give it sort of the same thing as a flu shot, because the flu shot doesn't stop transmission either, that maybe you'll have a less severe form of the disease, right? So I think there's this fear factor instilled in everybody, because they're like, well, if you don't get the vaccine, then you're putting your neighbor at risk or your grandmother at risk, and so on and so forth. But if it was a true vaccine, then you wouldn't be, right? So the person that's vaccinated should truly be protected against that disease.
So we were forced to get these vaccines. Hundreds of millions of people were forced to get the vaccine, and it's impacted. People have had adverse reactions to this vaccine we were told was safe, that was forced upon us. Now, what are you seeing?
So I'm seeing, and in our research, we can prove that the spike protein from the vaccine is still circulating in many people. At least, like I said, mentioned it the other night, a third of all of our cohorts have, spike protein from the vaccine. But also spike protein from the virus is very prevalent, even more so. But a lot of patients have both. They have the vaccine and the virus that's circulating, and it's inside many different cells throughout the body, immune cells. It's interfering with how the mitochondria behave, your B cells, T cells, all those different things. So this is a major problem. And as a result, and because it can impact every organ system in the body, you see all of these different symptoms and all of these different chronic diseases emerging.
Right, right. And just quickly, I know we talked about this a couple nights ago, but we got so much feedback after you were on. Is there a way do you have anything that people can do to help them feel better? Any way to detoxify the body and get rid of this spike protein?
Yeah, so there's a lot of things that people can do to detoxify and get rid of the spike protein and also the persistent virus. And they can use compounds like polyphenolic compounds, which are natural plant products, because you have to use synergistic compounds that are working together on all the different pathways that have been impacted by the spike protein and COVID. And doctors like myself, integrative functional doctors that understand cellular medicine, they can help patients like you or whoever's out there suffering get a handle on what's going on, get to the root cause, get rid of the spike protein, and then deal with the downstream inflammation that's occurred as a result of having damage from the spike protein or the COVID for months, if not years.
Yeah, Dr. Robin Rose, keep doing the work that you're doing. We'll have you back. Thank you. I will just say that if RFK were not leading this fight in Washington, we likely would not even be having this conversation on cable television. So that's a step forward. That's progress right there. Robin Rose, thank you.
Thank you.
All right.